Academies of Science, Engineering, and Medicine, the American Academy of Neurology, and AARP. For those of you who may not be familiar with BIAA, allow me a moment just to familiarize you that as the voice of brain injury, our mission is to improve the quality of life of people affected by brain injury across their lifespan through advancing prevention, awareness, research, treatment, education, and advocacy. If you'd like to keep up to date on our programs and all of the efforts that we have underway, we certainly encourage you to sign up for our newsletter and visit us at biausa.org. Now, at BIA, we certainly know that advancing brain health means creating policies and strategies that not only respond to the challenges that people with brain injury face, but that also focus on prevention and optimize brain function and recovery across the lifespan. And that's why we're honored to be partnering with, again, the National Academies, the American Academy of Neurology, and AARP on this webinar. In fact, each of our organizations are working to improve brain health through various initiatives. Allow me just to give you a bit of a snapshot with our partners. The National Academies convenes national experts through the Forum on Traumatic Brain Injury and advances evidence-based solutions to improve prevention, care, and long-term outcomes. The American Academy of Neurology translates science into guidance and public-facing tools such as the Brain Health Initiative and the Brain and Life website. And at AARP, they promote brain health at the community level, especially for older adults, through practical tools like the 6 Pillars of Brain Health and the Brain Health Resource Center. So I hope you can see and trust it's obvious why we're all working together for today's webinar. Now, before we get started, I want to bring you just a couple of special notes and some reminders. First, let me just give you some pointers about today's call. One, if you have questions, please do submit them using the Zoom Q&A feature. We're going to be moderating the Q&A feature, and we will try to get to as many questions as we can. We have a large group today, and so that's very exciting, but it means we may not be able to get to every question. But following the presentations, we will direct as many of them as we can directly to our speakers so they can address them live. So again, please chat them in advance using the Q&A feature. A recording of today's webinar will be made available online. And then lastly, as you might expect, we're unable to offer medical advice today during this presentation. So for any medical questions or concerns, please consult your healthcare professional. Next, if you have questions regarding the brain injury journey for yourself or a loved one, we certainly want to remind you or draw your attention to the National Brain Injury Information Center here at BIA. We're here to help. Through this program, we can help connect yourself or a loved one to information and services. You can see the email address and the phone number on the screen. And you can contact again, either via email or phone, the phone number being 800-444-6443. Lastly, before I introduce our speakers, I want to highlight, coincidentally, some exciting videos that are being launched today through a partnership between BIAA as well as the National Center on Health, Physical Activity, and Disability. These videos are based on the cognitive stimulation strategies created by the TBI model system at the University of Alabama, Birmingham, and they feature simple activities to help families connect with their loved one to support brain health after brain injury. So we, again, timely update, and we could not bring that forward, or could not bring that forward in today's call for you. So now let's introduce our presenters. It's my honor to introduce them to you. First, I want to introduce Dr. Christine Yaffe. She is the Scola Endowed Chair, Vice Chair, and Distinguished Professor of Psychiatry, Neurology, and Epidemiology at the University of California, San Francisco, where she also directs the Center for Population Brain Health, an internationally recognized leader in dementia and cognitive aging research. Her work has transformed the understanding of modifiable risk factors for dementia, including the long-term effects of traumatic brain injury. She's a member of the National Academy of Medicine and has received numerous awards for her contributions to brain health research. And next, Dr. Javier Cardenas. Dr. Cardenas is a neurologist and professor and chair of the Department of Neurology at West Virginia University School of Medicine. He is board certified in both neurology and child neurology with clinical and research expertise in traumatic brain injury, concussion sports neurology, and neurodegenerative disease. Dr. Cardenas has led numerous clinical and research initiatives focused on improving brain health and outcomes across the lifespan. And now it's my pleasure to pass the mic to our first presenter, Dr. Cardenas.
All right. Well, Thank you for that kind introduction. That was definitely not deserved, but much appreciated. Hello, everyone. Thank you very much for being here and recognizing that many of you are going through this. Many of you have loved ones and are caregivers for those who sustained and suffered from a traumatic brain injury. And we appreciate everything that you do. So starting off, as we heard, we're talking about brain health, specifically after brain injury. And in my case, in terms of the discussion, it is about traumatic brain injury, which would distinguish itself from other things, such as a stroke or a lack of oxygen to the brain. A few points of disclosure that I would like you to know, but do not have any influence on this discussion, including my work with the National Football League and the NCAA with respect to sport-related concussion, which we're not going to be talking too much about today. Starting off, indeed, the definition of brain health. As a member of the American Academy of Neurology, know that brain health is a continuous state of attaining and maintaining optimal neurological function. And I'm actually going to talk a little bit more about this as we get to the end of my presentation with respect to what does optimal neurological function look like at every stage of life. It supports the physical, mental, and social well-being. And it is really important to note that this is just not a physical state, not just an emotional state, but also a social state. A few things, of course, from the American Academy of Neurology. It is key to neurological health, core to our function. Our brains are irreplaceable. Our brains are where our personality resides. It is functional overall health of our community, requires collaboration. You're going to see more about that in just a little bit to promote prevention of disease, injury, optimize mental health and access. And in fact, there is a model for which we can look at this across a lifetime, from an early developmental stage, even quite honestly from a prenatal stage, and keeping babies' brains healthy and developing, all the way up to the times in which our brains start to shrink, in which we can address safety issues, in which we can address things that nourish and keep our brains healthy, and again, optimize brain health. Now, why traumatic brain injury? Why are we talking about this? It is the most common cause of morbidity and mortality in children and young adults. When we see these injuries, we are concerned about, of course, over a lifetime of care and need. If you want to ask one of the pop quiz questions, the most common cause of a traumatic brain injury is indeed a fall. If we're looking at our young adults, we see motor vehicle crashes that are indeed quite high. And for another even more significant quiz question, if you ask the question, what's the most common cause of a concussion in an NCAA athlete? It is a car crash, okay? Not a specific sport, as everybody would think. And it is an expensive condition, and you can see that it is not just so with respect to our own personal healthcare costs, but actually to society when people sustain these injuries, and of course to an individual family unit. Now, I want to make sure that we have a shout out to Kelly Sarmiento, who is at the Brain Injury Alliance of America, and was formerly with the CDC. So this is some of her work looking at death associated with traumatic brain injury. And there is a message in here, and that is that when it comes to the rates of death as it pertains to traumatic brain injury, you will find that the lowest rate occurs in New Jersey, where you have the highest density of population, versus low density populations such as Alaska. And you can see that there are intentional causes such as suicide and homicide. And in some states, that is the #1 cause of death. Now, looking at how this occurs, many of us have seen these images at the top right where you see this linear injury, a linear force, and we have this coup and contra coup impact where people will ask, well, I got hit on the front of my head. Why is there damage to the back of my brain? Or vice versa. I hit the back of my head. Why is there damage to the front of my brain? And that is that linear force where the brain moves within the skull. What is just as important, if not more so, is those rotational forces that also occur, especially in high velocities, such as car accidents, in which you have a rotational element that can cause things such as concussion, or more significantly, what is called axonal injury. Now, when we get into the details of this, we look at the primary impact, the primary injury, and then the cascade of events that occurs afterwards. I won't bore you with all the details, but the point is there's a number of things that happen in the brain. And this is where we try to intervene, both as a scientist and as a physician, in terms of the recovery of the brain afterwards. Now, many of you, again, experience this. Many of you have heard the definitions for mild, moderate, and severe traumatic brain injury based on the Glasgow Coma Score. Also recognizing that a mild traumatic brain injury is in no way, shape, or form minor. And it also represents the majority of the individuals who either come to the emergency department or are seen. Now, indeed, many people do not come to the emergency department, and so we have to look at other ways in which we can define this. So there's amnesia, which is less than a day for mild, witness loss of consciousness, 0 to 30 minutes, again for mild, and then alteration of consciousness, momentary to 24 hours. Now, the point of this is that there is a change in brain function associated with the physical trauma that will indicate or delineate that there has been a traumatic brain injury. Now, what's also important to note is that you'll notice that these things are largely insensitive to these things, and you'll notice that post-traumatic amnesia, or a gap in memory for a day, is really long. These tend to be brief. Witness loss of consciousness, again, if somebody is unconscious for 30 minutes, we are really concerned that something worse has happened. And so we recognize that these definitions are imperfect. And so we are looking at ways in which we can better define traumatic brain injury in terms of its severity in order to better understand outcomes. One thing, again, that we typically will identify that for those who have a mild traumatic brain injury, known as a concussion, their imaging should be negative. If there is any abnormalities such as a bleed or swelling, it is automatically worse than a concussion. A moderate traumatic brain injury, we anticipate that there will be some trauma injury, meaning blood, in this case in the temporal lobe. And then for a severe traumatic brain injury, 100% should be abnormal. Now, I say 100%, but there are cases in which we have the Glasgow Coma Scale is somewhat faked out, if you will. There are issues that can affect it, such as intoxication, or even somebody who has a seizure in which they can have a low GCS score, but not have any changes to the brain tissue. So please keep that in mind. Now, what is upcoming and what I think is really exciting in order to help us better define the severity of traumatic brain injury, and then, of course, outcomes, is these new blood-based biomarkers. And these are just a couple of them that I'm going to share. So something called GFAP, which represents an astrocyte. So these are the cleanup cells of the brain. And then, of course, the neurons, the ubiquitin carboxyl terminal hydrolase, otherwise known as UCHL1, represents injury to the neuron. And when we measure these in the blood, we find that the combination of them can give us an indication as to whether or not somebody would have a positive CT scan for blood or a negative one. I'm going to show you that just a little bit. So this is not unlike cardiac enzymes. So when somebody comes into the emergency department and they say, I have chest pain, they're going to do a number of things. They're going to draw blood, they're going to do EKG, and they're going to look at the patient and examine them. So similarly, somebody comes in with a head injury, they're going to obviously take that history, they're going to examine them, and now there's an opportunity to look at these blood-based biomarkers. These have been around for a little while, but implementation has been relatively limited. This is something that we have experience with at our institution. And I just want to give you guys a little bit of a peek as to how indeed it may help and how indeed they are currently being used. So this effort is not just limited to those clinical elements, but to those biomarkers, to imaging, and then of course to modifiers. So the way that we think about it is what the injury itself brings to the patient or the person, and what the patient or person brings to the injury. I'm going to highlight a few things. So all of these things can have an impact on recovery. So this is indeed an effort. The National Academy of Science, Engineering, and Medicine has been very involved in this effort for this recharacterization of traumatic brain injury and reclassification. And indeed, it includes that Glasgow-Coma scale. It includes those other clinical components such as amnesia, loss of consciousness, or altered state. It includes those biomarkers so we get an understanding of their levels at the time of injury and thereafter. It includes the imaging and not just whether or not there is blood there, but how much blood, where is it? Is it causing any change to the brain tissue, such as swelling? Is it causing any shift of the brain that could be cause a herniation and life-threatening injury? And so we're getting a very granular understanding of this. And then, of course, those modifiers. So I'm going to give a few examples. One is the mechanism. For people who are abused, domestic violence, we see that they have that mechanism of injury can impact the recovery because there's clearly very much an emotional element to that. And we see a lot of these patients in our program. And then, of course, there's age. Young people generally tend to recover a little bit better, but you notice there are other things, including, for example, a history of things like migraines, a history of anxiety, a history of a depression or learning problems. Those things can all impact recovery. People still get better, but it might take longer. So let's look at a few examples. So this is a 16-year-old who was in a motorcycle crash. I remember being on the bike and then showering in the hospital 2 days later. Of course, that was in the clinic. Had a witnessed loss of consciousness for less than 5 minutes and a GCS of 15 on an exam. Blood-based biomarkers were elevated significantly. And then on the CT scan, which you see here playing, it was noted that there was blood on the CT scan. So this young person was monitored. And then also what's important is that because of that, there was imaging. This is susceptibility weighted imaging, which is an MRI sequence looking for indeed that change that we saw on the CT scan, but also other things that we can't always see on CT scan, including axonal injury, which you see here. Now let's look at the reverse. A 26-year-old has a head-to-head collision. We see this all the time in sports. Remembers the impact, has no confusion, has no dizziness, has no vision change, but they hit their head. They were told to go to the emergency department. They have a normal examination. We do a blood test, which is negative. What action is taken here? Well, no CT scan. And this is important, just as important as that other test that told us that we need to do a CT scan and we need to identify that individual with traumatic brain injury and bleeding. But now we can avoid a CT scan of the brain, which means avoiding radiation, avoiding expenses, etc. And then finally, this last case, because we are talking about other things, including aging with traumatic brain injury, 65-year-old who fell, again, a linear fall, remembers being on the ladder, then in the emergency department. We don't have any evidence of witnessed loss of consciousness, and the emphasis on witnessed is that a patient, a person, will not know whether or not they've lost consciousness as somebody sees it. Could they have a gap in memory like this particular individual? Absolutely, that is amnesia. But there are many cases, even in sports, when we see somebody walking across the field, they have no memory of that, but they were clearly conscious. In this case, elevated levels. We do the CT scan. And we note that there's actually quite a bit of blood for this particular individual. Fortunately, on a repeat study, there was a significant decrease in this of that blood. But then in this particular case, we see scarring of the frontal lobes, and in this individual complaining of a lack of smell and taste. Now, what happens after these injuries? Well, death in a small percentage of them. Seizures in some of them, and you can see the risk of seizure for somebody who suffers what is classified as a mild traumatic brain injury is slightly elevated. The general population has about a 1 to 2% risk. Moderate and severe, and you'll notice it is not 100% for any of them. The most common symptom, the most common consequence is headache, and it is more so in those who have a mild traumatic brain injury than those with severe. Why? Not quite sure. Then there are cognitive problems. Sleep problems are somewhat independent of the other physical symptoms. And then something that not everybody thinks about is the hormonal changes that occur after a traumatic brain injury, including what is called hypopituitarism. These consequences can be grouped together: physical, behavioral, and cognitive. Those emotional changes can be anxiety, they can be depression as a direct result of the injury. And our approach is indeed a comprehensive multidisciplinary approach. This is not necessary, and there are many places that do the same thing with different people in different groups, but so long as they put the patient at the center, that is really the goal to do so. And then there is a rehabilitation. So looking at brain health and looking at recovery, those physical elements, those vision elements, those cognitive elements, and then of course you notice the earlier emphasis on the mood, psychiatry and psychology to address those mood-related changes. Now I'm going to end with this last component, and that is when we are talking about brain health, when we're talking about traumatic brain injury and recovery, what we have done is we have looked at these things and say, how can we apply these to people who do not have an injury? Can we prevent these injuries, and can we optimize brain function? And the way that we have chosen to do so is to look at those individuals who are the highest performing humans that we know, and that is our athletes. So we evaluate them for their reaction time, upper extremity that you see on the left, on the right for lower extremity. We look at their eye movements and see how coordinated they are. Looking at balance, again, is really important for us to measure these things in the highest modality that we can. And then we do are these things, these jumps, and looking at the way in which the body moves. Again, all of this is yes, there are physical and musculoskeletal things, but at the end of the day, these are all neurological in origin. And then recovery. So you'll notice this particular individual who is actually a triathlete, and what is needed for us to recover, not just after a traumatic brain injury, but also between exertions so that we can avoid further injury. And there are some things using those recovery modalities that we've been able to discern. And that is when we look at those athletes and we measure these things, so that on the left you see is a box jump onto a landing pad, force plate, and then we see on the right counter movement jump. When we analyze this data, we find that with recovery, at least weekly, then that we can have an increase in the propulsive force for the launching force and a decrease in the landing force. We find that there are decreases in injury, which of course we can now measure with those landing forces, and an increase in performance. Now, just to make a clear point here, this is not just for these athletes. This is our basis of understanding that neuroperformance applies to all people. So this particular gentleman, we want to enhance his ability to move independently, where we can measure a pre-intervention such as a medicine, such as a therapy, such as things like deep brain stimulation. But the point is to optimize brain function as we move forward. So again, when we are applying this to traumatic brain injury, the leading cause of morbidity and mortality for kids and young people, fall is the most common. Remember that quiz question? The majority of people fall into this mild range, but we are looking at ways in which we can better understand traumatic brain injury and just more than this mild, moderate, and severe category, so that we can better treat people and better provide prognostic information. We recommend a multifactorial and multidisciplinary approach to both prevention and treatment, and then of course to performance. So with that, I want to say thank you to everybody, but especially to the Brain Injury Association of America, to the American Academy of Neurology, and to the National Academies of Science, Engineering, and Medicine. Thank you very much.
Good afternoon, everyone. My name is Christine Yaffe. Thank you for the introduction, Rick, earlier. And thank you, Dr. Cardenas, for a great talk. I think our talks are quite complementary. I'm going to be talking a little bit more in detail about what the components of brain health are and what we can do to maintain and improve our brain health. They're going to be a little bit more of a focus on older adults, since that's really my expertise. And Kelly, thank you for doing my slides. Next slide, please. Just to remind everybody, Dr. Cardenas alluded to this, but obviously traumatic brain injury is extremely common in the US. We think almost 3 million injuries a year, so really a very incredibly common event. And of course, many people, 5 million, are living with a TBI-related disability. So this is a really common issue. It's wonderful to see organizations such as today coming together to work on this problem in a really holistic and collegial way. Next slide, Kelly. You know, I mentioned I'm going to focus a little bit more on the older adult. Dr. Cardenas mentioned across the life course that there are different times when TBI is more common. For example, in adolescents and young adults, very common motor vehicle accidents, sports-related, military. And then in the older adults, this is also another peak time of incidents, primarily falls, as Dr. Cardenas mentioned. It's also important that older adults are the ones who end up in the hospital much more. You can see from this graph that older adults are by far, those 75 plus, they're the ones who end up in the hospital, often because of they're more vulnerable, they have more comorbidities that may be associated with this, the etiology may be different, etc. So you might have a fall with orthopedic injuries as well. Next slide. What do we mean by brain health? Dr. Cardenas mentioned this. Again, I think the important thing for us is to remember this is a multidimensional aspect. This is not just my memory. This has to do with your thinking and your memory, of course, but it has to do with attention, problem solving, your emotional well-being, how well you're physically functioning, social, and ultimately one's quality of life. Next slide. I think one of the important evolutions and real changes in the last few years, which is extremely important, is that recovery does not end shortly after injury. I think the old model, we thought, okay, after a few months, that's about as good as you were going to get. There was a focus much more on acute care. People assumed you plateaued after a certain point, and that was sort of where you were. Our current understanding is that that's not true. Improvement continues for many years. It's an ongoing condition, not merely an acute event, according to the NASM work. And it's not limited to the first year, according to BIA. So this is, I think, a very important conceptual change. Recovery can go on for many, many years. And that's why we're so interested in brain health. What can we do to both prevent the injury, but also if an injury has occurred, how can we promote recovery? Next slide. Importantly, this is a study that my colleagues have led, looking at what recovery looks like in older adults. And one of the things that's very important is, yes, there's a continued evolution of recovery. Most people, 73% in this case, actually regain full independence at 6 months after a mild TBI. So that's really helpful to know. The other thing that's helpful to know is that your pre-injury status might really affect how this recovery process goes. If somebody has had a dementia or many, many medical problems, the recovery might not be as complete as somebody who without those or somebody who's younger. So I think this is an important concept. Next slide. Another fundamental aspect of this brain health is the idea of neuroplasticity. And what do we mean? We mean that the brain is able to actually remodel, restructure, find new pathways, and adapt to challenges, including a brain injury, whether that's a stroke, a head injury, or some other event, aneurysm, etc. It's really important to understand that the brain can change, it can evolve. And this may involve learning new skills, developing new strategies, doing something a different way than you used to do it, building on one's strengths. It's important to remember plasticity is not unlimited, but nonetheless, I think it's a very exciting concept that the brain can continue to change and remodel after an injury. Next slide. These are the 6 pillars of brain health that the AARP Global Council on Brain Health, which I actually happen to chair, has identified. And I think this is important for us to think about. And I'm going to go through each of these a little bit more in depth. But these are the pillars that we think that will enhance brain health, continue the road for recovery in the setting of injury. Be social, engage your brain, manage stress, ongoing exercise, physical activity, restorative sleep, and eat right, or nutrition. Next slide. These are 14 modifiable risk factors that a very famous Lancet commission, Lancet is a very prestigious British journal, actually the most cited medical journal, that has focused a lot on what we can do to maintain brain health and prevent dementia. We now have 14 modifiable risk factors that are listed, and importantly, TBI is on there. It wasn't on there in the last iteration, but I think this is really progress in putting TBI on the map of something that could be prevented and also is an important risk factor for brain health. Next slide. So now I'm going to go a little bit more into detail of some of these different aspects. What do we mean by engaging your brain? Keeping your brain active and connected. This helps build cognitive reserve, which is basically the brain's ability to adapt to change and remain resilient even after an injury. So one of the principles is being active, having education. This helps promote neuronal connections, synaptic health, and therefore, if one has an injury, you're better able to respond. It also has to do with recovery and brain health. If one can rebuild some of these connections, build synapses again, this is another way to improve your brain health journey. So what do we mean? Staying socially connected, staying engaged through working or volunteering, learning something new, a language, an instrument, something, a new game, whatever is interesting to you. I see patients and they say, well, I don't like to play bridge. And I said, fine, don't play bridge, but do something that you like, that you're challenging your brain and learning all the time. Take up a new hobby. These are some of the things where you're staying active, and we think this is a very important tenet of brain health. Next slide. Hearing and vision. We haven't really talked much about this, but sensory aspects are very important. It's not just about the ears and the eyes, it's also important for brain health. You can imagine that if one doesn't have great hearing, it's very hard to be socially engaged. It's hard to be learning new material, to be staying in the conversation. So one can imagine if you could get that treated or use your hearing aids more, get them tuned up, that it really improves one's ability to engage in brain health and to engage in the environment. Same with vision. We don't have as much data on this, but we highly recommend having visual checks and getting corrective lenses when at all needed. Next slide. Moving your body. We know that exercise and physical activity are key for the body, for the heart, but they're also important for the brain. Whenever I give talks, I remind people there's something called the neck. The neck connects your body and the brain. And we really need to remember that being physically active is important for all kinds of body functions, but in particular for brain health. And so this is really important. And there are, of course, recommendations for exercise, 150 minutes per week, strength training, even a small amount of movement makes a difference. Next slide. Restorative sleep. Dr. Cardenas mentioned that. He mentioned that after TBI, sleep can often be disrupted. But sleep also is very important for brain health in terms of the road for recovery. Now, why is that? Well, we think that sleep is really an important time for the brain to clear out the toxins, particularly those proteins that may accumulate in the setting of neurodegeneration, like Alzheimer's disease. It's also a time to improve blood flow and cerebral vascular health. It restores energy and emotion. It consolidates memory. So we think sleep is really important. There's a reason we spend a third of our life sleeping. It's not just a downtime. It actually is a time that the brain and the body are restoring and taking care of itself. So we recommend healthy sleep habits, aiming for 7 or 8 hours of quality sleep. Some people don't need as much sleep, some people need more. So it's not always the duration, but it's how well you're sleeping. Are you sleeping through the night? Are you tossing and turning? Or do you have sleep apnea so that you're getting up constantly? And you might not even know it. So, and if you have concerns, you should talk to your healthcare provider and be evaluated possibly with a sleep study, because there are good solutions. They're not always easy, but there are good solutions to improve sleep. Next slide. Another very important aspect of this is what's good for the heart is good for the brain. And what we mean are things that are linked to heart health, cardiovascular aspects, blood pressure, diabetes, obesity, cholesterol levels, smoking, excessive alcohol. These are all, of course, very important for the body, particularly for the heart, but they're also really related for the brain. Again, don't forget about the neck. So what can you do? Make sure you're on top of your blood pressure. You and your healthcare provider want to be having an appropriate target for you. Manage your diabetes, maintain a healthy weight, adopt healthy habits, eating habits, which we'll talk a bit more about, stop smoking and limit your alcohol, and follow your cardiovascular treatment plans. Next slide. Eating. We want to really focus on nutrition. We don't think that there's come to supplements. We don't think supplements are nearly as important as having a healthy diet. This could be something like the Mediterranean diet or the Mind diet. These are diets that tend to emphasize vegetables, whole grains, fish and seafood, with a limit on processed processed food, red meats, sugars, extra salt, etc. So we really think there's not one food that's the answer, but this healthy diet pattern. Next slide. And what about supplements? The AAGP Global Brain Council reviewed 20 different supplements marketed for brain health and really couldn't endorse any one in particular. Don't forget, supplements have a very different review process. They're not reviewed so much for purity or safety and effectiveness the way medications are. So the labels can be a little bit misleading. The marketing can say, "Oh, this supports brain health," but you don't really have had to have a whole lot of evidence. So we really don't recommend any particular supplement, but really focusing more on a healthy diet. There is an important exception that if you are deficient in certain nutrients or vitamins like B12 or folate, that may be a role for supplements, of course. Next slide. And finally, in terms of steps to do for the road to recovery, we need to focus on prevention. Many times, people who've had a TBI will have another TBI for either the same mechanism or some other mechanism. So we really need to make sure we're preventing further injury, preventing falls, wearing helmets, using seatbelts, avoiding substance abuse, and preventing repeat injuries. Next slide. Now, we've talked a lot about these promising everyday factors and how they are related to brain health. What works best in the setting of a TBI? We don't really know that. This is an area of active investigation. We know that these factors are linked to brain health. We know that they're often modifiable and we can do these, but we don't know yet what combination, what exactly is the right amount for TBI. So we're really trying to understand this better, what works in the setting of TBI. Next slide. We need more studies, of course, and this is an area that we're all very interested in. How can we tailor-make some of these brain health principles to the setting of TBI? How can we know what works for whom, to what extent? We need scalable and effective interventions to support brain health after TBI. Next slide. We actually, my colleagues and I are undertaking a new study. It's a trial called Train Vets, TBI Rehabilitation and Activation in Veterans, otherwise known as Train Vets. And this is a DoD-funded, pretty large trial where we're trying to enroll veterans who've had a prior mild or moderate TBI, and they have some cognitive symptoms, but they don't have a dementia or any significant cognitive problems. They will be randomized to an intervention or an education group. And the intervention really touches on some of the things I've talked about. We're trying to improve diet, sleep quality, social engagement, and then there's an aspect of cognitive training, so teaching people to harness the brain plasticity we talked about and engage in certain exercises and programs. And then a big focus is on exercise, in this case, aquatic exercise, as a way to improve physical activity and brain health. Next slide. Yep, next slide. Kelly, next slide, please. Oh, good, she did, sorry. Another point towards the end of my talk is, and I think Dr. Kidinian referred to this as well, but the recovery is a team effort. This is not just, sometimes it's not just on the individual to do all these things. We need to help individuals with TBI be able to access some of these things. We need to support brain health, and families and caregivers play a role. Healthcare providers play a role. Communities provide a role. You have to make some of these things available and be able to sustain them. So I think it's just a reminder, recovery is a team effort and everyone has a role. Next slide. This is my last slide, and I just want to emphasize some take-home messages that I think three important things. One, recovery can continue. I think this is such exciting message. It's not just at a certain amount of time. Recovery can take years, and I think that can be frustrating, but also hopeful that the brain remains capable of adapting and changing, and that can go on for a long, long time. Number two, everyday factors matter. These things we've talked about: exercise, heart health, sleep, social connections, cognitive engagement, sensory care, and prevention of a future injury. All are very important factors that we need to do and focus on. And number three, we all have a role. Brain health is a shared responsibility between the individual, providers, families, and communities. And finally, it's never too early and never too late to support brain health. I talk to a lot of people and they say, well, I never really was a big exerciser, or I never really, did this or that. Doesn't matter. It's never too late to start. Of course, we want people to start early and do this over the life course. Thank you so much for your time, and I think we may have some time for questions.
We do. Thank you so much. I just want to really acknowledge our speakers today, Dr. Cardenas and Dr. Yaffe. I've been in the field a long time, but I learned new things today, and I just really appreciate you guys engaging us with your expertise. I would like to just remind everyone, we do have a recording of the webinar. We'll be sending out an email with that. We'll also be sending a link to the new cognitive stimulation videos or brain exercise videos. There were some questions on that. So I'll be sure to include that in the email going out to the group. I do want to see if we can answer some questions live. So early on in the presentation, I'm going to direct this to Dr. Cardenas. Someone asked a question about blood-based biomarkers and whether they're being used in emergency departments, and wanted to see if you would be able to provide some insight on that. And then tied to that, the whole CBIM model and classification system.
Absolutely. So the short answer to the question is that yes, they are being used. However, they're not being used everywhere. And so it should not be an expectation that somebody walks into the emergency room and that they're going to do the blood test. What's also really, really important to know is what are the current indications for its use. And by that, I mean the clinical indications. So even though we're learning a whole lot about these biomarkers in terms of timing and recovery and even greater severity, in its current use from the FDA has to be within 12 hours of the injury. So you have the impact, you get to the emergency department within 12 hours. Now, the science shows us that it also has sensitivity within 24 hours. So just for everybody's awareness. The other thing is that when you're looking at this, it may not distinguish other types of injuries to the brain. So while it is sensitive, very sensitive to brain trauma, specifically blood related to brain trauma in the skull, it is not always specific to the type of injury that has occurred to the brain.
Excellent. Thank you so much. Dr. Yaffe, I have a question for you. Someone was wondering if you can explain a little bit more about post-traumatic insomnia after post-chronic insomnia after a brain injury.
Sure. So we know that after a brain injury, often, particularly in the first few months, there are sleep disruptions. It sounds like this person is asking about more chronic, so even long term. And it is something that we and others have studied, that TBI is associated with an increased risk of developing sleep problems, such as chronic insomnia. And it's complicated. Part of it may actually have to do with the actual brain injury and some of the disruptions in terms of sleep centers. Some of it may have to do with related PTSD. So depending on the setting of what happened, how the injury happened, it can be very traumatic. And this can sometimes lead to a lot of psychological disturbances. People can have depression, people can be anxious. This can also affect one's sleep. So I think there's several different possible reasons why insomnia and other sleep problems may emerge after a TBI. It is important to, if this is continued for such a long time, I think it would be important to really seek care with a sleep specialist or a healthcare provider who can at least try and tackle some of the etiology and recommendations for treatment.
Thank you so much. I wanted to, whether for each of you, whoever wants to jump in on this one, I think most of the content in the presentation focused TBI, but there were some questions about whether the information you presented is applicable to non-TBI
I'm happy to take that first. And the answer is yes. So, uh, a lot of the brain health principles apply really across any etiology of brain injury. We are learning more and more what works in what situation, and it may depend a little bit on the age and the mechanism of injury. But I think the basic tenets of brain plasticity and what we can do to maintain brain health, I think really apply across the board to most situations.
Excellent. Thank you. Yes. And
That
so I
Dr.
did.
Cardenas, you wanna
No, just really to emphasize that that is indeed the case. What should be noted that with respect to interventions after a brain injury, so other acquired brain injuries, stroke, lack of oxygen, some of them may differ. So please be aware that there are some therapeutic interventions that are not always applicable to anoxic brain injuries that are applicable to stroke and other traumatic brain injuries.
Okay, awesome. So thank you. We want to make sure that those questions are heard and they're really valid. And we would love to, just in response to some of the questions, love to do stuff where we do a deeper dive into stroke and some of other types of brain injuries. So more to come on that for all the participants. We do have a stroke symposium through the Brain Injury Association of America, so stay tuned on that as well. A question came up on alternative therapies. There wasn't much covered in the presentation on that. There wasn't a specific type of alternative therapy, but have you all have any insights or thoughts into that?
Sure, I'll start. So some of the alternative, a very common alternative therapy that we hear about is hyperbaric oxygen therapy for brain injury, a very, very common one. And when we look at the science and the research, a lot of it shows that the earlier on, the better. The problem is, of course, is that that's not always practical. The second piece is that it requires many, many treatments. And then the last one that I'll say is that even though right now, so a lot of the research does not support the use of hyperbaric oxygen therapy, it is something that we as physicians, we listen to and we look at the research and we recognize that when people ask a new question or reevaluate a treatment that in the past maybe did not show treatment benefit, that we look at it again, we evaluate it again. This is the way the science works, and that there may be some cases in which it is very helpful to certain individuals. Unfortunately, when they don't demonstrate that a type of effectiveness, then they're not often covered by insurance. And so even though this is obviously a medical question and medical treatment, we always, always concerned about patients and the cost of these types of things to them and to others, as well as other things such as safety issues. So that is number one. The last thing I'll say about in general about alternative therapies, the number one question and the number one thing that I consider for any alternative therapy is safety. And then beyond that, is there the potential to help? And then what are some of the other side effects? People talk about things like marijuana, how it can be helpful, how it can be problematic for some people. So knowing that even natural things that we find in our world, they can have also a negative consequence, even though they're not a synthetic medication. Anything to add, Dr. Yaffe?
Nope, good.
Thank you so much. So I've had a few questions asking about the video. So I'm going to go our new video. So I'm going to go ahead and put this slideshow back up so people can see the QR code to download it. Oh, sorry, I didn't mean to start from the beginning. Sorry, everybody. So there's a QR code for the video. I had a few people that asked for that. I'll also include the number for our National Brain Injury Information Center. So many of you shared your stories, which we love to hear and want to help and engage with you all. So that is a great resource. Our experts in the National Brain Injury Information Center can help answer questions and connect you to resources. One of our experts is actually featured in the video, Greg Ayotte. He's amazing. He's been with us for 20 years. So I just wanted to give him a shout out. But if you can scan the QR code, we'll also send a link to these videos. Tied to that, do you have any recommendations? This could go to either of you on where to find or types of sensory care or cognitive training, ways people can access that.
In terms of cognitive training, it's a little bit similar to what Dr. Cardenas was saying a little bit. There are a lot of companies out there that market for cognitive training and brain games and you know, it's hard to endorse anyone in particular because often they're not that well studied. And so it just you have to be careful, and you don't want to spend a lot of money on something that may or may not really have any evidence that it works. But there are a lot of computer games. There are a lot of you know, exercises. So there are a lot of things out there. I think one of the tenets is just to try and stay active and do things where you're learning new things, you're stretching yourself a little bit. And again, there's no right way or one way to do that. So I think find the things that you like to do. Are you the kind of person who likes to learn a new language? Are you the kind of person who likes to go to the Y and you know, engage with other people? That's what I would focus on. But there are many brain you know, computer games and companies that do offer this kind of cognitive activation. So just be careful because you don't want to spend a lot of money and then not know if it's you know, it's the right thing.
That's great. And oh, I'm sorry, I clicked to the wrong slide. I'm going to go to our National Brain Injury Information Center now, and we are getting close to the end. So I just wanted to open up to our two presenters to see if there's any remaining things that you or key takeaways you would like to share with our participants today on brain health. And then again, just thank you so much for participating, all of you that joined in, as well as our presenters. So I'll open it up.
Yeah, this was great, and I want to thank my colleague Dr. Cardenas, who you know we actually I think it was quite complimentary, and it was fun to do, and I want to just thank the organizers. It's again I think it's a nice testament to you know the communities coming together and recognizing the importance of brain injury and how we all need to work together.
Indeed, I echo the same. And so when we look at traumatic brain injury and we look at the consequences, they are physical, they are emotional, they are cognitive. And then when we look at brain health, all those things are true. One thing that is really important is that when we think of our brains, we have to think in those same categories, but also socially. We are social animals, and that is incredibly important for our brain health.
Excellent. So we'll end it there, but I just want to say thank you so much to the National Academies, the American Academy of Neurology, and AARP for partnering with the Brain Injury Association of America, and really appreciate it. And again, we'll be sending out a link for this recorded webinar. Please feel free to connect with us as we do webinars every couple of weeks on